Most men don't think about it until the symptoms become impossible to ignore. A few extra bathroom trips, a weaker stream, a little discomfort, nothing serious, right? But what if these small changes were the first warning signs of something much bigger? Ignoring prostate issues won't make them go away. In fact, waiting too long can lead to painful complications, embarrassing struggles, and even life-threatening consequences. The worst part? Most men don't realize the danger until it's too late. If you think it can't happen to you, think again. The signs are subtle, but the impact can be life-changing. Stay with us as we reveal the prostate problem most men ignore, and why taking action now could save your health. First on our list is blood in urine or semen. Blood in urine or semen can be alarming, but many men don't realize it's a common sign of prostate problems. This issue, known as hematuria or hematospermia, can be linked to conditions like an enlarged prostate, prostatitis, or even prostate cancer. While occasional instances might not be serious, persistent or recurring blood in urine or semen should never be ignored. It's a warning sign that something is affecting the prostate and requires medical attention. The prostate is a small gland that plays a crucial role in the male reproductive system, located just below the bladder and surrounding the urethra. When it becomes inflamed, enlarged, or affected by abnormal cell growth, it can lead to increased pressure on nearby structures. This pressure can cause blood vessels to rupture, leading to blood appearing in urine or semen. In some cases, infections or injuries to the prostate can also contribute to this condition. One of the main culprits behind blood in urine or semen is benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate. As the gland grows, it can compress the urethra and affect normal urinary function. This increased pressure can cause tiny blood vessels in the prostate or urinary tract to burst, leading to visible blood. Though BPH is not life-threatening, it can significantly impact a man's quality of life if left untreated. Prostatitis, an inflammation of the prostate, is another common cause. Bacterial infections or chronic inflammation can irritate the gland, making blood vessels fragile and prone to breaking. Men with prostatitis often experience pain, discomfort while urinating, and even sexual dysfunction. If the condition is severe, it may lead to prolonged episodes of blood appearing in urine or semen. Next, we have erectile dysfunction and low libido. Erectile dysfunction and low libido are often overlooked as symptoms of a prostate problem. Many men assume these issues are purely related to aging or lifestyle, but the health of the prostate plays a crucial role in sexual function. When the prostate is affected by conditions like enlargement, inflammation, or cancer, it can interfere with the nerves, blood flow, and hormone balance needed for a healthy sex life. One of the main reasons prostate issues cause erectile dysfunction is their impact on blood circulation. The prostate is closely connected to the blood vessels that supply the pelvic region. When the gland becomes enlarged or inflamed, it can put pressure on these blood vessels, restricting blood flow to the penis. This reduced circulation makes it difficult to achieve or maintain an erection, leading to frustration and anxiety in many men. Hormonal imbalances also play a role in low libido when the prostate is unhealthy. The prostate helps regulate testosterone and other hormones essential for sexual desire and function. If the prostate is inflamed or affected by disease, it can disrupt the normal production and conversion of hormones. Lower testosterone levels can lead to a decrease in sexual interest, energy, and overall well-being. Nerve damage is another major factor that links prostate problems to sexual dysfunction. Conditions like prostatitis or prostate surgery can affect the delicate nerves responsible for triggering erections. When these nerves are irritated, inflamed, or damaged, the communication between the brain and the penis is weakened. This can make it difficult for a man to respond to arousal, leading to frustration and decreased confidence. Chronic prostate inflammation can also cause discomfort and pain during intercourse, further reducing sexual desire. Pain in the pelvic region, lower back, or perineum can make intimacy uncomfortable or even unbearable. Over time, this discomfort can lead to avoidance of sexual activity, causing strain in relationships and emotional distress. Next, we have frequent nighttime urination, nocturia. Frequent nighttime urination, also known as nocturia, is a common yet often ignored sign of an underlying prostate problem. Waking up multiple times during the night to urinate can be frustrating and disruptive, affecting both sleep quality and overall health. Many men assume it's just a part of aging, but in reality, an unhealthy prostate can interfere with normal urinary function, leading to this persistent issue. One of the main reasons prostate problems cause nocturia is the pressure placed on the bladder. When the prostate enlarges or becomes inflamed, it can press against the bladder and urethra, making it difficult to empty the bladder completely. As a result, even small amounts of urine trigger the urge to go, forcing men to wake up frequently throughout the night. This constant disruption can lead to fatigue, irritability, and reduced daily performance. Another key factor is the weakening of the bladder muscles due to prostate issues. When the bladder has to work harder to push urine past an obstructed urethra, it becomes overactive and more sensitive. This increased sensitivity makes it feel like the bladder is full even when it isn't, leading to frequent trips to the bathroom, especially at night. Over time, this cycle of urgency and incomplete emptying can worsen, making sleep disturbances a regular struggle. Inflammation and irritation from prostate conditions can also contribute to nocturia. If the prostate becomes inflamed due to infection or chronic irritation, it can cause a constant feeling of bladder pressure. This sensation makes men feel the need to urinate more often, even if the bladder isn't actually full. The result is repeated awakenings throughout the night, leading to exhaustion and frustration. Next, we have persistent pelvic pain or discomfort. Persistent pelvic pain or discomfort is a symptom many men ignore, often attributing it to aging, muscle strain, or stress. However, ongoing pain in the lower abdomen, groin, or perineal area can indicate an underlying prostate issue. This discomfort can range from mild to severe and may be constant or come and go in waves. When left unaddressed, it can interfere with daily activities, sleep, and overall well-being. One of the main reasons prostate problems cause pelvic pain is inflammation. When the prostate becomes inflamed due to infection or other conditions, it can put pressure on surrounding nerves and tissues. This pressure leads to a persistent aching or sharp pain that may radiate to the lower back, inner thighs, or even the rectal area. The pain can worsen when sitting for long periods, during physical activity, or after ejaculation. Nerve irritation is another key factor in prostate-related pelvic pain. The nerves surrounding the prostate are highly sensitive, and any swelling or dysfunction can trigger discomfort. This irritation can create a burning or throbbing sensation in the pelvic region, making even simple activities like walking or urinating uncomfortable. Some men experience sudden, sharp pains that come without warning, disrupting their daily routine. Urinary dysfunction linked to prostate issues can also contribute to pelvic pain. When urine flow is obstructed or irregular, it can cause bladder irritation and spasms. This irritation leads to a heavy, pressured feeling in the lower abdomen, often accompanied by discomfort during or after urination. If the bladder cannot fully empty, the buildup of urine can further strain the surrounding muscles and nerves, intensifying the pain. Last, we have weak or interrupted urine flow. A weak or interrupted urine flow is a frustrating and often ignored issue that can indicate a deeper health problem. Many men assume it's just a part of aging, but when the urinary stream becomes slow, weak, or starts and stops unexpectedly, it is often a sign that something is interfering with normal bladder function. Over time, this issue can worsen, making urination a slow, uncomfortable, and sometimes incomplete process. One of the main reasons for a weak urine stream is obstruction. When the urinary pathway becomes narrowed or compressed, urine struggles to pass through easily. This can cause a noticeable decrease in force, leading to a slow, dribbling stream rather than a strong, steady flow. In some cases, the obstruction can cause sudden pauses in urination, forcing men to strain just to empty their bladder. Bladder muscle dysfunction also plays a role in weak urine flow. If the bladder has to work harder to push urine past an obstruction, it can become overworked and fatigued. As a result, the muscles lose efficiency, leading to incomplete emptying and a weak stream. Over time, this strain on the bladder can lead to further complications, including frequent urges to urinate and discomfort. Another major factor is nerve interference. The nerves responsible for controlling the bladder and urinary muscles can become irritated or damaged, disrupting the signals that regulate urination. When these signals are weakened or delayed, the muscles fail to contract properly, causing hesitation, a slow start, or interruptions in the stream. This lack of coordination can make urination frustrating and unpredictable. Urinary retention is another issue that often accompanies a weak stream. When urine cannot be fully expelled, some remains trapped in the bladder, creating a constant feeling of fullness. This leads to repeated trips to the bathroom, especially at night, as the body struggles to clear out what wasn't fully emptied before. Over time, urinary retention can increase the risk of infections and bladder stones. The strain of pushing urine through a restricted passage can also lead to discomfort or even pain. Some men experience a burning sensation or pressure in the lower abdomen due to the extra effort required to urinate. This strain can also cause swelling and irritation, further worsening the issue and making each bathroom visit a struggle.